Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. We'll be speaking with Dr. Dan Faden, a specialist and investigator in head and neck surgery at Massachusetts General Brigham Mass Eye and Ear. He's joining us to discuss his presentations from the 2023 American Academy of Head and Neck Surgery Conference titled 10 Hot Topics in Head and Neck Surgical Oncology Panel and Great Debates. ctDNA, is it ready for prime time? Welcome to Health Professional Radio, Dr. Faden.
Thanks for having me.
Give us a look into your professional background, please.
Sure. So I'm a head and neck surgical oncologist at Mass Eye and Ear and Mass General. So that means I take care of patients with head and neck cancers. And in particular, today we'll be talking about HPV-associated throat cancers a lot. So that's one of the types of cancers that I take care of. And that's about half my time. And the other half of my time, I run a research laboratory that studies HPV-associated cancer and malignancies. And in particular, we focus on development of blood-based cancer tests, or what's called circulating tumor DNA assays.
What was it that piqued your interest in focusing on head and neck surgery as your specialty?
Yeah, well, head and neck cancers are, very interesting for a couple of reasons. First of all, the surgeries are very intricate and delicate. And the impact on patients is immense in terms of not just their cancer journey, in terms of their oncologic outcomes, but also in their form and function. And working in this area has major impacts on how patients look, how they speak, communicate, swallow, breathe. And so these all have to be taken into consideration when we treat patients. In addition to that, in this field as surgical oncologists, we play a large role in the management of the patients, not just their surgery, but in follow-up, managing complications, and have almost a primary care-like role that we assume. And so there's a lot of longitudinal connection to patients as well, which was very attractive.
So what is it that you're seeing currently as the hot topic in your particular specialty?
Yeah, well, definitely one of the hot topics right now across cancer in general, including head and neck cancers, is the application of blood-based cancer tests. And most of these are tests that detect what's called circulating tumor DNA, ctDNA. These are tests that try and pick up fragments of DNA from the cancer cells that circulate in the plasma. And within head and neck cancer, there's been a major focus, particularly on tests that detect what we call circulating tumor HPV DNA, ctHPV DNA, in HPV-associated cancers.
ctDNA, I heard you mention its function, but what exactly is ctDNA and how do you see it shaping the future of head and neck surgery? Sure.
So all cells in your body break down and die and release fragments of DNA into the circulation. And so most of that DNA comes from normal, healthy cells in your blood, but cancer cells do the same thing and release fragments of the cancer genome DNA into your blood, and that can be detected using specialized approaches. Over the last 10 years or so, there's been a real revolution in the technologies that are available to accurately detect ctDNA, which then can be used across many different clinical contexts, anywhere from cancer screening, and that field is called, you may hear the term MCEDs, or multi-cancer early detection tests, through diagnosis, and the most data is in the monitoring space. So utilizing these approaches to detect recurrences earlier than standard of care, which would be, for example, cross-sectional imaging.
How prevalent are these head and neck surgeries, and discuss some of the current challenges?
Sure. So overall, worldwide, head and neck cancers make up are about the sixth most common cancer. So they're actually relatively common. Today, we're focusing a bit on HPV-associated head and neck cancers. HPV-associated head and neck cancers are now the most common HPV-associated malignancy in the United States, so they're more common than cervical cancer, which is the cancer that most people associate with HPV. There's about 14,000 new cases of HPV-associated head and neck cancer each year in the United States. The overall challenge with treating head and neck cancer in general is that, as we mentioned before, your head and neck and your digestive tract, your upper digestive tract, when you do anything to ablate the cancer, remove it with surgery or treat it with radiation, has major impacts on patients' quality of life, in particular things like swallowing. And so there's many challenges that surround adequately treating patients for their cancers and achieving cure while balancing that with giving patients a reasonable quality of life after treatment.
And as far as this reasonable quality of life, if it's chemotherapy as opposed to surgery, does that matter at all when ctDNA is implemented?
Well, the utility of ctDNA, I would say, is actually agnostic to the treatment approaches being taken. ctDNA is a biomarker of disease status. So not only does its presence indicate the presence of the cancer, but it's also quantitative. So the amount that's there correlates with the tumor burden. So as the cancer goes away, the levels go down and should go to zero, basically immediately once the cancer is gone, and they come back up if the cancer recurs or with the presence of a cancer. And so while there's, specifics to how ctDNA behaves, by that I mean the kinetics, like how quickly it clears or the trends that happen based on the treatment that you're getting, the principles are very much the same across treatment, which is that it's a real-time biomarker of disease status.
Is there anything that you'd like to add for our listeners, and then give us a website where we can learn more about ctDNA?
Sure. So I think the thing to know is that there's a real revolution happening in cancer diagnostics right now, which is moving from tissue-based diagnosis and tissue and imaging-based monitoring approaches to blood-based approaches that largely focus on ctDNA, and these are being applied across many different clinical contexts. And I believe over the next, 5 to 10 years, we're going to see these approaches being utilized even more, and in many instances, probably starting to replace standard approaches such as routine cross-sectional imaging for monitoring. In HPV-associated cancers, that these approaches focus on the detection of HPV DNA, and there's a large and constantly growing body of literature suggesting these approaches likely outperform current standard of care.
And as far as getting more information?
Yeah, so there's many different sources for information on ctDNA. My laboratory focuses on developing these tests for HPV-associated cancers. And so I'm happy to refer you to my lab website, which is Faden, Faden, lab.mgh.harvard.edu.
Dan, I appreciate your time this morning. I'm hoping that you'll come back and give us some more updates.
Thank you. It was a pleasure speaking with you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Dan Faden. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.